Hello, everyone, and thank you for joining me tonight for another Ask Miss Jai Live. I am so excited to be here with you today on this lovely Sunday evening, or if you're watching this on the replay, whenever it is and whatever time it is. If you are catching us today, today's topic will be all about prepping for a doctor's visit. So some of the things that you can anticipate doing ahead of time. Also, if you have any recommendations yourself on how you've prepared for your doctor's visits, please include them in the comments below, or in the comments here. And if it's live, then we'll be able to share those recommendations on air as well. If you are joining us live, also, if you put a hashtag live in the chat, I would love to see that you're here and welcome you to the space. If you are catching this on the replay, then go ahead and put a hashtag replay and please share your own recommendations on how you prepare before a doctor's visit. And also let me know what were some of the things that were most interesting or that maybe you hadn't thought about before. My name is Miss Jai. I use feminine and masculine pronouns, so she, her, and he, him. And I am the host of Ask Miss Jai Live. My background is in HIV prevention and care and trans and non-binary health and wellness. And I've worked in both public health agencies and in clinical settings in infectious disease and hospitals. And so I'm going to be sharing a little bit about how you can prepare for a visit with the doctor. But also some of these tips and some of these ideas can also be used when you're preparing for a visit with anyone who's providing you with a health service, for sure. So one of the challenges that came up, one of the reasons why we're doing Ask Miss Jai Live is because I often get asked by providers how they can better support trans and non-binary people, and we know that one of the biggest health disparities that trans and non-binary people is having access to providers who are affirming their identity and are willing to work with trans and non-binary people to address their health needs. And so that's how Ask Miss Jai Live got started. But one of the other things that came out of this is a need for us to share more information across our community as trans and non-binary people. So though today's recommendations are for trans and non-binary people preparing for their visit, I encourage any providers who might be listening to think about how you can also coach up your patients or your clients before they are going to see a physician around some of these recommendations. And if you're working as a case manager, then this can also be a really great way to work with a trans or non-binary client that you might have, just around what they can anticipate and how to best prepare themselves for it. So stick around. We're going to be talking through a couple of different pieces. If you have any questions, feel free to put them in the chat if this is live. If it's on the replay, again, thank you for joining us. You can also feel free to put your questions in the chat or any recommendations. So one of the first things that is helpful for us to think about when going to see a provider is that likely we're not the first trans or non-binary person who has attempted to go see this provider, whether that be the physician specifically or the larger system that the physician is in. And so one of the things that I recommend first is that if you are getting prepared to go see your physician, ask your other trans and non-binary friends what their experiences of that setting has been. So if this is a physician who works with trans and non-binary people on a regular basis, ask your friends what their experience was like when they went to see the physician. If you're going to a large hospital setting, so maybe you're going to see a primary care provider and there are several dozen in this system, but you have another friend who goes to a different primary care provider in the same system, ask them what their experience was like finding the office, what it was like for you to enter into the space. Are there accessible restrooms? Were you ever asked about your identity? That can all kind of just give us a clear understanding of what we may encounter in the space. That being said, like, we could still go to a visit and meet with someone who is super helpful and super affirming, or on the opposite end of that spectrum is super unhelpful and super unwelcoming. And so it doesn't tell us exactly how we're going to experience the space, but it can give us some more information. The other thing, before I move too far into this, the other thing for us to consider is what our resources look like in the community. So if you're living in a large city, you may have access to more than one primary care provider. You may be able to see more than one kind of specialty. There may be several folks who do the same specialty. So if you go see this physician and have a negative experience, then you can always reschedule at a different office or with a different provider. But that's not the case for everyone. And so having this information means that we can then make an informed decision. Our health ultimately is what's most important. And we really shouldn't let anyone, including a provider, get in the way of us being able to access our health and our wellness. And so having this information means that we might make a more informed decision about how we choose to show up to our visit or what we choose to disclose, or how we might talk about our identity or not talk about our identity in order to get our health needs met. And that's one of the challenges with the system, is that sometimes we do have to hide portions of our identity in order to get the care that we deserve. And I don't advocate for that, but I do recognize the reality of it and that it is a necessity sometimes. The second thing I would recommend is calling your insurance before your visit. So some things you're going to want to ask. You're going to want to ask, is the provider and uh, is the provider in network or out of network? Because there will be a cost to you that's different. For some health insurance plans, if they're in network, then it might be covered in full, or there might be a copayment, or you might have to meet a deductible. So you might have to pay up front until you hit a certain number. And then after that, visits will be covered or will be at a lower amount. Um, However, lots of health insurance, when a provider is out of network, there's either little coverage, so they may cover a portion of the appointment, but not all of it, or no coverage. And so we won't find that out as the person going to the doctor until we're being billed for that. And we might be told at the time of visit, they might say, hey, you're actually out of network for your health insurance. But just so that we can be prepared and know what the cost potentially to us is going to look like, I would encourage you call your insurance ahead of time and just make sure it's in network. And then also verifying that what you're going for is a covered service. Because if it's a non covered service, then your insurance might say, we're not going to cover it at all. In which case, you're then responsible for the bill. And doctor's bills are expensive. So ask just ahead of time, like, is this a covered service? Is it not? Um, and verifying like which portions of this might be covered. So can I go in and talk to my primary care doctor about starting hormone replacement therapy? But if I'm also concerned about erectile dysfunction when I start on hormones, is that something that's going to be covered, or is that considered a non-covered service for erectile dysfunction? So it's a way for us to kind of parse through and figure out which portions of our visit may be covered, and also know, like, okay, if ED or erectile dysfunction isn't going to be covered, then maybe I don't talk about it at this visit. So this visit is still covered. And maybe I schedule a separate visit, or I go see, I schedule like a phone appointment visit or with my primary care doctor because it will be cheaper. Because that's the other thing, primary care is going to be cheaper than specialty care generally. And so if there's things that we can take to our primary care physician, then they'll ultimately be cheaper for us if we end up getting charged for them. So call your health insurance. The other thing is that this can help us to figure out if there are any medications that aren't going to be covered too. So you might find, I was working at a space. I won't say their name, but I was working at an organization that would cover certain kinds of hormone replacement therapy and wouldn't cover other kinds of hormone replacement therapy. So they would cover things like injectable testosterone, but they wouldn't cover the gel or the patch. So knowing like which versions you're likely going to be starting on, and asking if those are covered medications, can also help you to give that information to your physician, so your physician knows which ones to order as your prescription. And you can even say, I called my insurance and they say that they'll cover this injectable medication, but they won't cover it as a patch or a pill. Or they won't cover it as a topical cream, right? And when you tell that to your physician, if there's nothing that's counterindicated for your health to be on another version of it, then you're not going through this rigmarole of, I went to my physician, they ordered a medication, I went to the pharmacy says it's going to be full price. I'm now trying to get a hold of my physician to send a new prescription. It becomes kind of a nightmare. So calling your insurance ahead of time can be super helpful in just getting the information, the bits and pieces that you need. The next recommendation I would suggest is writing down your questions before you get to your physician's office. So if you're calling because, I'm focusing on like gender affirmation, or I'm focusing on like hormone replacement therapy, surgical affirmation, um, medical transition, those sorts of things. But we might be going to see a physician for a variety of reasons. We might have a cough, and we don't, and it hasn't gone away for 3 weeks, and we're getting really concerned about it. Or we might be going to start prep, or we might be going to because we need an annual physical for an activity that we're doing with work. I don't know. Like, there's a lot of reasons we see doctors, and so knowing what you made the appointment for, go ahead and write down questions ahead of time related to that topic. So if you are going because you have you're concerned about something upper respiratory, you're concerned because you've been coughing nonstop, write down questions like, are there any foods that I should avoid while I'm coughing like this? Are there any activities I should avoid while coughing like this? Is it okay that I'm still going to the gym or still going on walks or going for runs? Is it okay that I'm still smoking during this time? A physician likely is going to tell you that smoking is not going to help your upper respiratory anything. But these are just some examples of like questions we can start to brainstorm for ourselves, and can bring to that visit so that we're focusing on what we have scheduled the visit for. Because sometimes, as trans and non-binary people, when we get into our visit, we may find that either there's a hyper focus around our identity, which then makes it difficult for us to get our health needs met, or that there are assumptions made about why we are in the physician's office. So the assumptions could be that we are trying to get medical care for transition related care, but really we're coming in because we've had walking pneumonia and we didn't know it, right? So having these questions prepared ahead of time means that we can try and focus it as much as possible on on what we are concerned about. And then also part of that is, going into this visit, being prepared to not necessarily have all your questions answered. Physicians sometimes have back to back appointments. Um, they may sometimes have appointment timeframes that they have to meet a patient in. So I know that when I was working in infectious disease, we had 20 minutes for each patient that we had to get them through the system, see the physician, and get them processed out. 20 minutes is a really short amount of time, and generally the physician is going to have some sort of checklist that they're going to need to or want to go through with you in order to rule out some things and also do their due diligence that they are providing adequate care to everyone. So, knowing that not all our questions might be answered, it can be helpful for us to prioritize which ones are most important to us, and that we want to make sure we ask first. And then also let the physician know when we are in front of them that like we have some questions that we've prepared because we want to we have some questions that we have prepared, and letting them know that we know that they likely have to go through a checklist or have to ask some standard questions, but that it's really important to you that you get your questions answered, that you really want to focus in on why you are there for your health needs. And so, like, can we move through these standard questions quickly? Or can we save the standard questions for the end of our visit, so that we can focus on the questions that I have. And I think when we approach it that way, we're more likely to bring a provider on board with us, to either answer our questions first or be like, okay, let me trim down the standard. Like, what is the actual information that I need to gather from you? And then we can focus on your questions. So approaching it respectfully and just saying, like, I have questions and I want to make sure that they get answered. And I know that we don't have a lot of time to talk. And then I would encourage, if you have access to someone, but bringing someone that you trust with you to a visit, especially for visits that are going to be particularly intense. It can be helpful to have a second person there. someone that you trust, someone that I would say someone that's like family or is very close to you, that is going to keep confidence around what is shared in the visit, but can also help to do things like take notes about what's being said. Um, for you to review later and also help advocate for you in that situation. So not override. You don't want to bring like I don't want to bring my like a sibling with me who gets like really hyphy at the drop of a hat and really upset at the drop of a hat, right? Because I don't want them to escalate a situation if I'm being like talked over or something like that. But I do want to bring someone with me who is going to be able to say, for example, like, so you just said, you physician just said X, Y, and Z, and these contradict one another. So can you clarify for the so that we're all understanding how to support one another? Or I've also seen advocacy take place where it's like a person is continually being misgendered or being called by a name they don't go by, and so being able to have an aside with the medical staff or and say like, hey, you keep misgendering this person. Their pronouns are actually X, Y, or Z. Um, it can be difficult sometimes to have an advocate in that sense in that space. So even if you don't have someone who's like going to be able to advocate in a way that is respectful in that space, having a second person there to help take notes, especially if we are getting a lot of information all at once, can be super helpful. So, for example, like I've sat in on medical visits with some of my family members, and it's a way for us, like, I would write down, take notes of just like what was being prescribed, what the amounts were supposed to be. Um, what the concerns were, what next steps would look like if this medication didn't work, what considerations or restrictions would look like, right? So, like, don't do a lot of physical activity, try and avoid foods that are solid. I don't know. But like writing down these things can be helpful because if a lot of information is being given in a short amount of time, then it's really hard for us to recall all of those pieces. And often, as a patient, we're trying to engage with the physician and we're trying to be present in what's being said to us. But I know for myself, I'll do a lot of like head nodding, and I'll leave with probably like 30% of what has been shared. And when I was on the physician side, the clinical side, I wasn't a physician, but when I was on the clinical side as a case manager, I saw that happening where like a physician would be giving a lot of information that maybe they've given 6 times that day, so it's really commonplace for them. And the patient or the client is just like nodding, but it's clear that something is not absorbing. So having someone there to just write down information can help us to still engage and be present during the visit, but also make sure that we are getting information, and we're able to review it later as well. And I will say that it's standard practice to give patients paperwork at the end that just like says like, this is what we've diagnosed you with, this is what your recommendations are. um, and that's great. It doesn't always happen. So having that information written down on our own can be helpful, but also when we're writing it down on our own, we see how we are interpreting the information. And so even if we do get that paperwork that says like, okay, you've been diagnosed with an upper respiratory infection. Take this medication at this dosage, and we go to our notes and there's a different amount, and it's saying take this medication at this other dosage. Then we can get clarification from the physician and say, like, hey, in my notes it says this amount, on the paperwork it says this amount. How frequently should I be taking this? And that's really important because we are human and mistakes do occur. And sometimes they occur in things like dosage amounts. So it's important for us to be able to know when they are different or when we have information that's conflicting and get clarification. And then I would also just know like so these next two recommendations kind of go hand in hand. The first is like be prepared for to potentially need a second opinion. So depending on what we are seeing a physician for, if it's something like a cough, or we're going to like an urgent care, or we're going um, to get an illness treated in the in an acute stage, so like in the right now, then we might not have time for a second opinion. But I think for some of the other things that our community face interfaces with medical care for, so like especially transition related stuff, I think preparing for a second opinion allows us to have more autonomy in the decision making that's happening. And what I mean by that is we're able to say ahead of going into an appointment, okay, I'm going to hear some information today. This information is the opinion of this provider and their expertise, and they are an expert and they have gone to school for medical care. I know that this is the opinion of this provider and their expertise. And so that means that it may not be completely aligned with what I feel for myself and what I need for my care moving forward. And so if I am prepared in that way, if there are red flags that come up throughout that conversation, we'll be less likely to um, almost like gaslight ourselves a little bit, but like less likely to ignore those red flags and instead be like, okay, something about this doesn't sit right with me. It's time for me to go ahead and get a second opinion. And then the other piece that kind of goes with that is be prepared for multiple visits. So if we know that providers are going to have a short amount of time to see us, they may not be able to address all of the health concerns that we have in one visit, especially if we've been out of care for a really long time. Um, I think for myself, I need to see a physician around my blood sugar levels. I need to see a physician around my asthma. Need to see a physician around care. I need to see a physician around this weird pain in my back. I need to see a physician around some like the fact that I keep having like uh, allergic reactions to my dogs, right? So I have like 5 or 6 things that could easily pull from, in a first visit. But generally, during a first visit, there's going to be some standard questions that are going to need to be asked in order to create a patient profile. And also, in one visit, we're unlikely to be able to get to all 5 of those things. We might be able to get to 1 or 2 of those things in a first visit, maybe. And even in follow up visits, we might be able to address 1 or 2 of those things. So just be prepared that it might take multiple visits to start whittling away at all of the questions that you have, and to start addressing these different health concerns. So that's why I say like rank them for yourself to see which ones are most pressing for you, because that will help you focus on which ones you want addressed sooner and which ones can be at the second or the third visit. um, I think it's hard because when we're motivated to make a change, we want to, especially around our health, when we're motivated to make a change, we kind of want to jump in with both feet, and make that change. And especially if you're like me, where motivation sometimes can be difficult to pull up, we want to make all the changes right now. I'm going to start eating better. I'm going to start exercising more. I'm going to start going to bed at a regular bedtime, right? So um, we need to be prepared that this that not every we're not going to be able to fix everything in one visit. We're not going to be able to address all our health concerns in one visit. And I think when we're more realistic with ourselves around that, it's easier for us then to be understanding and also not get frustrated or upset when we're not able to address everything in the first visit. And also like understand like, okay, like we weren't able to address these things in this visit, so I'm going to let my physician know next time, can we talk about X and Y, and or number 2 and number 3, and in the following visit I'd really like to talk about number 4 and number 5, because these are the important health changes that I'm wanting to take. This is the important information for me. So that's some of the ways that we can start to focus in on those pieces. And then I will say one more thing about, as trans and non-binary people, around preparation for a visit specifically. Um, I know for myself, there are times that I've felt uncomfortable in a lobby or in a waiting room, especially if it's somewhere that's new, that I'm not entirely certain how they are going to react to me being visibly trans, visibly femme and masculine in one space. Um, and so some of the things I've done around preparation for that has also included things like being mindful of what I'm wearing. I think we do this a lot as trans and non-binary people. We think about like, well, what am I wearing and what environment am I going to be in? And to some extent that's protective because we don't want to be treated poorly. And so I think that we can prepare ourselves in those ways and say like, okay, well, I for this first visit, I'm going to wear jeans and a t-shirt, or for this first visit, I'm going to dress down a little bit. And it can feel a little bit like recloseting, and that can be really hard. And so if that doesn't feel if that brings up a lot of dysphoria, and it brings up a lot of these like, oh, like icky feelings, then some of the things we can also do is we can also call our provider, or whoever we've made the appointment with ahead of time. We can call them and ask them like, what is your policy on supporting trans and non-binary patients and clients? What does your non-discrimination policy look like? Does it include gender identity and expression? Are there public restrooms available in your waiting room? If there are public restrooms available in your waiting room, do you have any gender neutral or single stall bathrooms? So these are ways that we can also start to become prepared for the type of environment we're about to step into. And so I would say, like, if we ask about non-discrimination policy, if we ask about how trans and non-binary people are supported in the space, and we ask about bathrooms, and we get answers back that don't feel comfy. If the non-discrimination policy is just like, oh, it's general, I don't know what it is, or if we're like, they're like, oh, we have two bathrooms, but they're multi-stall, or there's a men's and a woman's or whatnot, then we already kind of know the type of environment we're going to be stepping into. And so we can prepare ourselves for that, because again, at the end of the day, we still need to get our health needs met. At the end of the day, we are deserving of healthcare, and we're deserving to be able to thrive in our health. And that includes sometimes being getting services from spaces that are not wholly affirming for us, and that can be a difficult thing for us to navigate. So if we are preparing ourselves and we're saying like, okay, well, I know what kind of environment this is going to be. I know that because of this type of environment, there are likely going to be there may be other clients or patients who are unfamiliar with seeing trans people present. And so how can I prepare myself? So it might be like, I'm going to meditate before I get out of my car and walk into the building, or I'm going to take my morning and make sure that I'm hydrated and I'm nourished and fed, so that when that adrenaline hits me and I'm starting to get anxious and nervous, it's not exaggerated, because I'm also um, hydrated and fed, and I've taken some time to like calm my nervous system down. Or things like, I'm going to make sure that the half hour or the hour after my appointment, I don't have anything else scheduled, so I can have some time to sort of decompress and do some breathing exercises and do some mindfulness and calm myself down after the visit, in the event that it is triggering or intense. So these are some ways that we can also prepare ourselves ahead of time, but also prepare for how we're going to engage in almost like an aftercare for ourselves after going to the physician's office. So I it, I hope that my goal with talking about how to prepare for a doctor's office visit is that we will be realistic around what the doctor means to us as trans and non-binary people. There is a history of trans and non-binary people being mistreated in providers' offices and in healthcare settings. There is the research that came out from the U.S. Trans Survey showed that violence takes place in physicians' offices, both verbal harassment and physical violence. And so I think we can be honest around what it means for us to be in those environments, and also recognize that there are ways for us to still protect ourselves. And there are ways for us to still enter into those spaces, because we are deserving to be in those spaces and having our health needs met. And a lot of us delay healthcare. I mean, earlier I listed off 5 things, and I will say that even someone who has worked in health environments and worked in medical settings, I to delay getting my health needs met. And so a lot of us delay getting our health needs met. And really, what that ends up doing is it ends up meaning that those health conditions are much harder and much more intense to treat in the future. So, the best care that we can get for ourselves is preventative care, checking things before there's an issue to make sure that we are, that our bodies are as healthy as possible, and that we're doing everything we can to keep them as healthy as possible. So I hope that these recommendations are helpful. I hope that I don't think you need to do all of them. It can be a lot to be like, okay, I found a friend who's going to go with me. I'm going to write down all my questions. I'm going to call my insurance. I'm going to call the physician's office and find out their non-discrimination policy. I'm going, but it's a lot to do. But even if we do one or two of those things before each visit, we'll feel more control over the situation and we'll feel more control over the decision making in our physicians' offices. And really, and I hope that physicians that are watching this, or if you are a service provider watching this, really one of the things that we can do to help instill autonomy in our patients and our clients is by giving our patients and our clients the ability to make health decisions for themselves and helping to guide them to decisions that feel comfortable for them, and feel affirming for them. So I might offer you options, and say like, where are your health goals at right now? Let's talk about what you would like to work on and how can I help support you in that, because that's how we build autonomy, in our patients and our clients. And on the flip side of that, taking these steps for ourselves is how we build autonomy in getting our health needs met. So I hope this has been helpful. Again, my name is Miss Jai. Every Sunday we have Ask Miss Jai live at 5 p.m. Mountain Standard Time. I'm so thrilled that you were able to join today. If you're here live, please put a hashtag live in the chat. I'd love to see the folks who are present. And if you are catching this on the replay, please put a hashtag replay and, either way, share your recommendations. How do you get prepared for a doctor's appointment? What are some things that you like to do ahead of time? And they don't all have to be um, like logistical, like, oh, I write down everything, but they could be like, what are some ways that you calm yourself before going to see a doctor? What are some ways that you prepare yourself knowing that you're going to have to be in this medical environment later and potentially feel vulnerable talking about your health? How do you prepare? Because I think that there's a lot of ways that we can learn from one another. So thank you again so much for joining. My name is Miss Jai. I use feminine and masculine pronouns, she, her, and he, him. And thank you for continuing to invest in the health and well-being of trans and non-binary people. Until next time.